Dr. Ray has introduced different themes of behaviors that patients can bring into treatment that can become barriers in treatment to really moving forward in the treatment plan. So what we're going to be talking about specifically are those barriers that you might see, the therapy interfering behaviors that you're going to see in treatment. We've probably all seen them, maybe we've even done them ourselves, right? If we've had our own treatment or just in our lives. So we're going to specifically be going over the different barriers, and then we're going to be looking at interventions. So what you can specifically hope to learn today is how to identify the therapy interfering behaviors in treatment, how to understand the function of those behaviors. That's what's super critical, is that just because you see a specific behavior as a barrier doesn't mean you really understand why it's happening. And the idea is that with the right case conceptualization, you can really come to understand the function of that behavior. So we're going to be looking at that. We're going to also learn to implement effective interventions to address those behaviors and move forward in treatment, because ideally that's what we want. We want to be able to move forward and help the patient attain their treatment goals. And then we're also going to look at some therapist barriers. I know that doesn't happen in here, right? All of us are pretty perfect, I understand that. But we're going to be looking at some therapist barriers and then some recommendations. They're just recommendations, just stuff to think about, because there's always room for growth. No matter how old, no matter how many years you've had in practice, I think we're always students of life and learning. So let's kind of jump in. Dr. Reyes was talking about themes of barriers to treatment. So there are two types of themes that we came up with. One is going to be avoidance behaviors. So I want you to think about avoidance behaviors are any type of behavior that a patient presents with, consciously or unconsciously, right? Knowingly or unknowingly, that serves to help them avoid dealing with the problem, avoid really looking at the underlying issue, or to avoid dealing with the feelings connected with the problem, right? Because does anybody in here love to be in emotional pain? Anybody love that? Yeah, I don't, right? So our patients don't either. So they're going to do all sorts of things to try and avoid that emotional pain. So that's what we're going to flag, is what are those behaviors that get in the way that function to serve as avoiding that pain. And then the second theme is acting out behaviors. So again, sometimes when we're in emotional pain or patients are in emotional pain, they're going to act out. They're going to do things that are maybe uncharacteristic of them. When people are in depressed states, they're going to do things that maybe they wouldn't typically do. So we really want to identify what are those acting out behaviors. And for the purposes of this presentation, we're identifying any passive communications, passive-aggressive or aggressive communications as acting out. And it's likely something that's been learned, and it's something that we want to flag as a pattern and then help to deal with. So those are going to be the two themes. So now let's really jump into our therapy interfering behaviors, and let's start with avoidance behaviors. These are fun, right? So late to session, things that you might typically see: missing sessions with or without calling repeatedly, not completing their assigned homework, dishonesty, right? Not being honest. Sometimes little white lies, sometimes they don't want to disappoint. We'll look at the function later. Avoidance of addressing conflict with the therapist or just people in their life, right? Dr. Reyes was talking about when we go to address conflict, it's uncomfortable. And so a lot of people don't want to deal with it. Y'all can relate to that. Yeah, so that comes up as part of a therapy interfering behavior potentially. More avoidance behaviors: refusal to participate in aspects of treatment. So maybe they're willing to show up on time, but they're not really doing the homework that you assign them. So really looking at the whole treatment and refusal of aspects. Continual state of crisis. So this is the person that comes in week to week with a different fire. And although that can be helpful to help them put out the crisis and problem solve, it kind of feels like we're not moving in treatment. We're not addressing underlying issues because we're in a constant state of crisis, right? So that can be a therapy interfering behavior. Externalizing problems. So this is where the patient's going to focus on everybody else. You know, if my situation would just change, if I could just get my job back, if my partner just didn't leave me, I would be okay. And therapy, as you know, part of our goal is to help people to reflect, to understand their responsibility, because ultimately, can we change anybody else? No, we can't. We can only change ourselves. So unless your whole family's in therapy, we're going to focus on you. Dissociation. So this is a protective mechanism that the brain naturally does, right? And then some people who've experienced a lot of trauma, they're going to be more prone to dissociating, but this can be seen as an avoidance mechanism where if they start talking about something in therapy that's really tough to talk about, they might then kind of compartmentalize and go into another space, and that can actually interfere with being able to do effective treatment. And then intellectualization, this is talking through your emotions. I call it number crunching your feelings, right? I can tell you how I feel all day, but it's really different to feel how I feel. And so if we, especially, there's a bunch of smart people in this room, if you're with someone who tends to be number crunching their feelings, you want to bring them down to their heart and get them out of their head. But we'll talk about that. Okay, so